And thank you everyone for being here. And I really do appreciate you taking the time on a Saturday and also the Home Shala staff and faculty. Um, really appreciate studying with you this year. And hopefully everyone will find this presentation mildly interesting, although I don't think it can top our previous video, but we will try. We will try. Okay. So can you just tell me that you can see this, okay? And somebody unmute and just let me know you can see
I
the video.
I can
Yeah.
see. Yes.
Okay, excellent. Thank you so much. All right, so I will be presenting on the topic of perimenopause and menopause. And the topic name, a little bit of a mouthful, menopause as a complex condition, musculoskeletal health through the lens of yoga therapy. So, to give you an outline of what we're going to be discussing here today, we will first take a look at the condition itself, musculoskeletal syndrome of menopause, as it has been very recently coined. And then we'll also take a look at the physiology of menopause. We'll take a look at research insights and what Western medicine has to say about the condition. And then we'll do a pretty hard pivot and delve into some yogic frameworks as well as yoga therapy applications. And in this portion of the presentation, we'll explore some barriers that people may experience when seeking out yoga therapy. We will explore the concept and I just ideas around pain and the implications for yoga therapy. And then we will take a look at how you would create an intervention, or as we say, a protocol. And then we'll take a look at the key takeaways. So this is going to be a dense presentation, just so you know. Bear with me, please. Feel free to kind of like get up and move around if it starts to get too much. All right. So the condition itself, musculoskeletal syndrome of menopause is a recent term, and it's really looking at an umbrella condition with a constellation of symptoms. So it's not like a single one thing, it is a multitude of both medical things and symptoms all mixed in, and that's why we would consider this to be complex. Among some, unexplained joint pain and body aches, muscle and bone density loss, as well as progression of osteoarthritis. But these musculoskeletal conditions themselves or symptoms themselves can actually be overshadowed by even more acute symptoms, such as mood swings, right? So now we're like in this cognitive aspect, mood swings, brain fog, sleep disturbances, but also metabolic, such as hot flashes and gynecological urogenital. Okay, so you can see that there's just a lot. There's a lot happening to a woman's body. The interesting thing, though, is that when a woman goes in, if something is happening and she goes in, bringing these symptoms to her doctor, there might be absolutely nothing wrong with her diagnostically, meaning that, you know, if she had blood work done up or some imaging, like nothing would show up. All right. So she might literally get from her doctor that there's nothing wrong with you. and yet it has a huge impact on her quality of life, and we'll see what exactly that is, right? So as a whole, musculoskeletal syndrome of menopause, I kind of shorten it to MSM, impacts mobility, impacts mental health, and overall impacts quality of life. And so we're going to take a look at that a little bit more detailed. So you have a sense. All right. But before we do, I just wanted to bring in a little bit of like an anecdotal evidence. And these are just literally some of my friends who are in this life stage talking about it, right? So Tatiana says, "Oh, when I wake up in the morning, my body hurts." Amy says, "Ah, that's what all these aches and pains are after all, right?" Like after I told them, "Oh, there is a term for it now." And then Maria says, "Occasionally my whole body hurts. I'm trying to figure out what I did the night before, the day before, and it's not too much, but I'm still in pain." All right. And then Rachel says, "My low back has gotten so finicky. It's never been that way before." So here we are, women entering their, this perimenopause stage, starting to notice things with their bodies. And these are actual quotes from my friends. And now we're looking at this kind of scary table from one of the research studies that I used for this presentation in my paper, right? And so here you can see, oh my God, they really stacked this up. So on the left, the processes that happen, and on the right, the signs, how these processes, present themselves. So we have inflammation, which is a huge process that's happening, and it can present as joint pain, joint discomfort, frozen shoulder, probably heard of that. You can't lift your arm past a certain degree. And arthralgia is just a fancy way to say joint pain, joint inflammation. Sarcopenia, a medical term for uh, muscle mass loss of muscle mass, okay, or decreased muscle mass. But it can also present as poor balance and falls, which definitely increases risk of fracture to the bone. It can present as loss of stamina and walking slowly, or as I like to say, trudging. Sometimes if you get tired at night, especially, and you experience this, you're just kind of trudging and you're like, where is my brisk walk? And you just can't get to it. Okay. So that could be because we're losing muscle mass, unfortunately. Decreased satellite cell proliferation, very fancy, but just think of the fact that as we enter this life stage, we lose the ability to gain muscle, or it's just much harder for us to build up muscle mass. All right, so because of these satellite cells. Osteoporosis, very well known, very well documented condition. We know that osteoporosis means loss of bone strength, or like a more porous bone, but it can also present as loss of height, stooped posture. It can also present as back pain. And then there's a risk of fracture in addition, right? And then finally, again, back to arthritis, which is sort of really connected to inflammation, arthritis, inflammation in the joints, arthralgia, joint inflammation, right? Joint pain and stiffness. So you can see from this table that this is a huge impact to a woman's quality of life. Huge. Absolutely. Even one of those things, right, will impact her. All right. And so then I just wanted to give you a sense of like, well, what is menopause? We all talk about it and we heard it. So I have a short, just a few minutes from the Huberman Lab, and it's Dr. Mary Claire Haver, who is one of the OBGYNs who's like very openly talking about menopause. She has a book out and she's on Instagram, she's an influencer. But she's kind of funny. The way she talks about it, I like it. So I was going to play just a few minutes of this for you guys.
Welcome to the Huberman Lab podcast. Wellness. Before we begin, I'd like to emphasize that this podcast.
I'm just going to put it to the.
Dr. Mary Claire Haver, welcome.
Thanks for having me.
Delighted to have you here and to learn about menopause and other aspects of women's health. There's a lot happening in this area right now.
Yeah.
And you are at the center of what I understand is a new direction for the understanding and treatment of menopause.
That's what we hope.
And related themes like perimenopause.
Yeah.
And the many important aspects of female health that stem from it, like cardiovascular disease, osteoporosis,
right,
and so on. So we will get into all of that today. But just to kick things off, how do we define menopause?
So the medical definition of menopause, which I have a huge problem with, is 1 year after the final menstrual period. And the reason why I have a problem with it is not everyone has a menstrual period. What if you've had a hysterectomy? What if you have an IUD? What if you've had an ablation or something that's suppressing your periods, PCOS? So for a lot of women and even clinicians, they are struggling to find that diagnosis because it doesn't fit everything. What it represents is something much bigger. Menopause is also 1 day of your life. It is that 1 day, exactly 1 year after your last period, but it represents the end of your ovarian function. Some of us call it ovarian failure, ovarian senescence, but basically what separates males and females is many things separate us. But in my world, we are born with all of our eggs. We have 1 to 2 million at birth. By the time we're 30, most of us are down to about 10%, maybe 120,000. By the time we're 40, we're down to 3% of our egg supply. And the quality is declining as well. So menopause is when you have no more eggs left and therefore no more sex hormone or very little sex hormone production from the ovaries. So estradiol levels will decline less than 1% of your reproductive years. Your progesterone levels will decline as well. Testosterone declines for sure, but we have other ways to produce it. So it's somewhere 50% or less than your healthiest years.
So if you want, you can listen to this. It's really interesting. And she is she's just very easy to understand, very engaging. But you heard it, right? Menopause is just a single day, exactly 1 year from your last period. And basically at menopause, you are out of your estrogen. It's almost at zero. We'll take a look at that as well. But it varies quite widely among individuals. The onset of menopause can be anywhere from 45 to 55. So that's actually a pretty big spread, I would say. And then perimenopause, which is a period that starts with some symptom presentation, can be 7 to 10 years prior to that. So if you do the math, you can see that women as young as 35 can actually experience perimenopause. And yet, when they go to a doctor in their mid to late 30s, they're completely gaslighted because they're being told, oh, you're too young. You're too young, and given no treatment and no option to figure it out. And of course, the menopause marks the end of ovulation, so the woman's reproductive years. All right, so then to give you a visual of what that would look like, take a look at the graph on the left, and you can. This is these graphs. They track estradiol, which is a form of estrogen. So we're in the endocrine system. And you can see that estradiol sort of peaks right in the mid 20s. And then it kind of plateaus, maybe it declines a little bit through our 30s. And then there's a pretty significant drop somewhere in the early to mid 40s. And then in this case, they're saying menopause at 54. The estradiol is almost at zero. So it's a huge drop in a short period of time. And then the graph on the right with all the waves, it's called zone of chaos. And a zone of chaos is interesting because before the onset of perimenopause, you can see that the fluctuation of estradiol are just, they're fluctuating according to the menstrual cycle. But in perimenopause, it starts to go absolutely bonkers. And that's why it's going zone of chaos. And so that reflects in the body, right? So we feel these things, the hot flashes, all the things. is actually visually depicted right here. And then once we hit menopause, it kind of goes back to some low level fluctuation, but just there's not a lot of that to fluctuate. All right. So both perimenopause and menopause can be pretty hard on the woman's body. Okay. All right. And so in terms of research, well, thankfully now there's a lot of research um, on what happens during this life stage and what happens to the endocrine system and the overall system as estrogen starts to decline, fluctuate, and then drop to nothing. Estrogen has some very significant anti-inflammatory properties. So estrogen is a hormone, right? And it as estrogen declines, right, we experience global inflammation, right? So joint pain is just one way for our body to signal that we're experiencing inflammation. But even if we don't necessarily have pain, our body is experiencing a lot more inflammation because as estrogen declines, inflammation increases. Why is that significant to yoga specifically? Well, because there's a growing body of research, almost like spamming PubMed, that links yoga to a reduction in systemic inflammation, yoga and yogic practices. All right. So as the in the perimenopause and menopause, estrogen starts to decline and diminishes, and inflammation in our bodies increases, inflammatory cytokines to be more precise. Yogic practices can do a lot to mitigate that particular condition. Okay. And then additionally, and we'll take a look at that as well, studies link long-term yoga practice to higher tolerance of pain. Because if we're experiencing pain, but we then know how to cope with pain, we're actually in a slightly different and much better seat on the bus than the general population. All right. So then looking at treatments and what's available out there to treat the condition. And allopathic approach, just a fancy way to say Western medicine. MHT, menopause hormone therapy, is at the forefront of treatment options for women experiencing perimenopause and menopause. All right. Not to be confused with HRT, which is sort of like an old school term. Because we're not replacing hormones, we are supplementing. We're not completely out of our hormones. Um, there's been a lot of research done on MHT, and current research, thank God, suggests that benefits grossly outweigh risks. Grossly outweigh risks. All right. Some of the benefits: joint health, so reduction in inflammation, reduction in stiffness and pain, immune health, right? Less sickness, muscle and bone health, so less porous bone, more muscle mass, metabolic, either a reduction or diminishment completely of hot flashes and night sweats, and then your genitals, so less incidence of urinary tract infections or none. All right, so really huge benefits. It's almost like a miracle drug, which is like what we have when we have estrogen, don't realize we have it, and then once we don't have it, things are things become a little bit more dire. Um, in addition, though, to MHT, there's a lot of considerations around lifestyle, and that's really, really huge as well, right? Because anytime you're dealing with a health condition, if you have unhealthy habits, they're just going to exacerbate everything. So here, looking at diet and nutrition, it's really imperative to figure out your diet, have a healthy diet, but even more so, it is imperative to have the correct intake of protein. My paper, which is 25 pages, if you have time to read that kind of stuff, it actually talks about how much protein. Okay. Weight loss. So weight loss recommended because if you have additional weight on your body, it's going to impact your joints, right? So the load-bearing joints, especially in your hips, knees, and ankles, are going to be impacted by additional weight that you carry on your body. Lifestyle and movement habits. So we already know that sedentary lifestyle is unhealthy for many different things. It's still unhealthy for perimenopause and menopause. And we also know that smoking is bad. So that's not a surprise, right? Not a surprise here. As far as supplementation, there's really a lot out there on what kind of supplements you can take. But if you were to just start with vitamin D and calcium, you're in pretty good shape. Okay. Resistance training is huge for building and rebuilding lean muscle mass that we tend to lose as we enter perimenopause. And there's a lot of protocols now that say that training with weights is really important for women in their 40s and up. All right, but there's also complementary modalities, and I put acupuncture here just as an example, chiropractic, massage therapy, you name it. It definitely helps to do your research when you're thinking about those modalities. And of course, among them is yoga and yoga therapy. So, we will talk a little bit about a distinction between yoga and yoga therapy. But just to start, yoga therapy itself is based on the principles of balance, and we'll get in a lot more into that as well. Um, Yoga therapy tends to treat the whole body, tends to treat the experience of your condition, but also the narrative resulting from that experience. So in this particular case, you might be experiencing joint pain and night sweats, just making this up, pick from a hat of unpleasant symptoms. But you might start to create a narrative in your mind that you're getting old, you're going to die, and you're undesirable. And that's not a helpful narrative to carry around. And especially, it's not a helpful narrative if you're trying to counter the symptoms that you're experiencing. So, yoga therapy will get to that too, the narrative. Okay. So, if yoga therapy is an effective way to treat, and we will take a look in detail as to why. What are some barriers? All right, well, lack of understanding because it's a new modality, and it is. So there's just not a lot out there just yet, not in the same way as there is about like acupuncture, right? That's been around for a lot longer. Maybe cost, because yoga therapy is traditionally done in a one-on-one setting, and it costs a lot of money. And so a lot of yoga therapists don't take insurance, right? So there's that whole hurdle. And then I wanted to touch upon this sort of cultural, perhaps, confusion around movement and types of movement and put that straight. So here, let's take a look as to what kind of movement we're talking about. So yoga therapy it actually bridges these two types of movements, functional movement and end range movement, because it uses it pulls from the modality of like physical therapy, but it also pulls from the modality of yoga asana. Right, so let's take a look. Functional movement, usually we talk about ADLs, activities of daily living. And so functional movement is really good for building strength, confidence in your body. And it's also great to build joint support, because as you build strength in your body, your muscles will support your joints better, right? Both at the hips, the knees, the spine, you name it. But functional movement does not include breath integration, so there's absolutely no breath work involved. And it can be accessed through a fitness gym, PT. So those are the areas where you would go to start to look at functional movement, right? End range movement. different types of movement patterns, right? So here we're talking more about taking our joints and tissues to their full available range. Here we're looking at building resilience, both physical and nervous system. We're looking at enhancing flexibility, all right, of both muscle and fascial. And we're looking at training or retraining the nervous system. This is all through end range movement. This is where it's just literally still pure movement. But it does and should, and if it doesn't, do not go. It should include breath integration, right? So it should be taught by a teacher who knows how to integrate breath. And that kind of movement is usually found in yoga, but also some dance modalities like ballet, right? Now, why put this up here? It's really important to understand that when people think about yoga, they sometimes have this narrative of yoga is for people who are really flexible. And if I go to a yoga class, everyone's doing it right and I'm doing it wrong. And yoga therapy will be just that. So it can create like that barrier, whereas it's just completely not true, right? So we have to communicate that no, yoga therapy has both of those aspects and is taught one-on-one and is taught by a very experienced yoga therapist. All right, so here comes like a hard pivot and wanted to take a look at what is yoga therapy really grounded in, right? What is it based on? Well, it's based on hatha yoga, which itself is grounded in the principles of harmony. Right? So restoring health to a single area will either harmonize or integrate balance to the whole. And that's called principle of mutual rhythm. So if you think about like a mechanical watch, right? And then there's like a little snag in the cog. So that cog will snag the entire system. It'll throw everything out of balance. And so if you target that cog, and then once that's restored, the whole system, okay, will then function optimally. All right. So kind of like just a way to think about it. It also is grounded in balancing the body's dual energy channels through pranayama practices. So a little bit less tangible here because we're talking about energetics. And then specifically talking about the major energy channels that are present in the body. There's two that are called Ida and Pingala, left side, right side. Those are targeted through like a Nadi Shodhana, like different pranayamas. And then there is also pranic vayus, energy currents, and those can be also targeted through pranayama and prana and apana are the two primary ones that we can balance. Prana is intake, apana is outtake, right? So think left side, right side, in and out. There's more, but these are just the primary ones. So if one of them is out of balance, the whole thing will be out of balance. Okay. Yoga therapy is also looking at cleansing the system, or not yoga therapy, hatha yoga specifically, is looking at cleansing the system of accumulated wastes we call doshas. And those wastes can be physical, they can be mental, but they can also be energetic. So there is dimensionality to how we hold unhelpful whatever in our bodies, right? It doesn't just have to be something physical, like a mental one will have an impact on a physical and energetic, and so on and so forth. So all right, so we're kind of think about it, we're going from like the outside in, we're kind of drilling down, and we arrive at this really great framework, and I work with it a lot in my classes. And this framework is called Panchamaya model. This is the Panchamaya model. So where did Panchamaya model come from? Well, it actually came from one of the, like a primary source is this Taittiriya Upanishad, which is a yogic text um, from a long time ago, from a very long time ago. Um, and it describes this framework. We're talking about different layers of being, to be precise, 5 layers of being. They're like sheaths, right? And you have a picture for a visualization of these sheaths. Um, and so this Upanishad, this yogic text describes the koshas, as they're called, as nested, but not separate, right? So even when we say like dimensionalities or sheaths, like right away our mind like separates them, but actually they're not really separate. One is more subtle than the other, or like one is more refined than the other. And the one that's more subtle permeates the one that's more gross. So that's how they're connected, right? And so it's a continuum, right? It's not like an onion, honestly. It's not. It's something else. Um, and then I wanted to take a look at like how somebody in a more modern world would describe the koshas. And Swami Rama describes them as interwoven dimensions, right? So remember, like dimensionality of being, so interwoven dimensions that fluctuate with changes in your mind, breath, and behavior, right? So one thing will affect the whole thing, right? And then the International Journal of Yoga Therapy describes them as interconnected layers exhibiting bidirectional influence, right? So they are always impacting the layer that is before and after them, or a continuum of a biopsychosocial spiritual experience. All right, so what are the koshas? What are the kosha? Let's take a look. So cool. Cool, right? So cool. I love this stuff. That's why I'm here talking about it. All right. So, what do the koshas do? What are they? Okay, so there's 5, like I said, right? And we always start from, remember this picture, right? Little nesting dolls. So we're going to start from the red one. That's the gross one. That's the physical one, right? So think of it from the outside in. So the gross one is called Annamaya Kosha. It's our physical body, the one you can touch. And I said that the koshas will fluctuate like with each other, but they also fluctuate among themselves. All right. So they also have their own continuum within each layer. Okay. So in this case, the Annamaya Kosha, physical body, fluctuates along a continuum from ability to limitation, right? So our physical body can be very able. You can jump into a handstand, right? Think Simone Biles, and then think somebody of like in a wheelchair, and that is still the Annamaya Kosha, right? Huge range, right? The Pranamaya Kosha, the breath body, is a fluctuation also, right, between an inhale and exhale, inhale and exhale. So always in motion. The Manomaya Kosha mental emotional body encompasses full range of emotion, right? And so joy to sorrow, healthy, right? Healthy if you can pendulate, but if you can't pendulate, if you're stuck in sorrow, that's an issue, right? Vijnana Maya Kosha wisdom body, fluctuating between clarity and confusion. Same, right? You're always clear on what to do. Wonderful. Sometimes you're confused, fine. But if you're always confused, it becomes really difficult to live your life. And then Ananda Maya Kosha, it's called the bliss body, but I don't want you to think of it as like euphoric. It's not euphoric bliss at all. It extends along its own continuum from this sort of experience of inner coherence to experience of complete isolation. Okay, so from being interconnected to the web to completely isolated, which is really And I wrote access to this kosha may be restricted, and that's because when we look at working with the koshas, what we do is we cultivate the other four first, and the fifth one is spontaneous. You can't really work on an Anandamaya kosha. It's a spontaneous experience. Okay, so the access to this kosha may be restricted because you haven't done the work. Okay. Um, So, having taken you through the koshas, how do they relate to menopause? They really, really marry to menopause very nicely. All right. I'm very excited about that because systemic shifts, right? So, in menopause, perimenopause, menopause, also, I hate those words, are pretty big systemic shifts. And hormonal structural changes, right? So systemic, huge things happen in the body, not just one thing, many things. We saw that before. Um, alter, alter, altering breathing, energy mood, right? Cognition, perhaps even worldview, right? Remember we talked about the narrative. And so we can see how the condition, right, creates an effect and how these shifts are reflected in the kosher. So let's take a look. So in the physical body, right? Simple. Experience of musculoskeletal pain, fatigue, right? Inflammation. So pretty tangible, makes sense. Well, in the breath body and the mental emotional body, too, that makes sense. Shortness of breath if due to anxiety, maybe um, loss of cognitive function, so that brain fog, right? Mood swings, uh, sleep. Okay, that could be an issue. In the wisdom body, uh, yeah, I put the brain fog there, and actually, is that goes there better. Because anytime we're experiencing brain fog, there is this lack of clarity. We can't really access our wisdom if we're experiencing brain fog. It becomes very difficult. And then thought about this a lot about the Anandamaya, how Anandamaya kosha is affected. And I want to think about it that if we are experiencing a very, very big shift in our bodies and in our minds, um, we might lose like a sense of self. Like we might lose ourselves. We might lose ourselves or a sense of self, right? And that could be a loss of self-confidence, a loss of identity, because there's a big identity shift that happens during this period. And so we might not necessarily articulate it that way, but it could be felt in the Anandamaya Kosha, this lack of inner coherence. Like everything was fine, and I woke up and things are no longer fine, and I can't put my finger on what's happening. And you become really unmoored. And that's really scary. Okay, that's really scary. Um, okay, so great. How do we mitigate symptoms, right? Because the symptoms are severe, and even if they're not severe, if we're experiencing being unmoored, that's a severe symptom in and of itself. I have a friend, and she was saying to me, she's like, I don't know what's going on because I will be walking down the street and I'll see a flower and I'll want to smell the flower and cry because this flower is so beautiful and smells so great. And if I'm next to my husband and I turn to him and I just want to strangle him, all in a span of like a minute. What, right? Wow. That's crazy, but that's a real woman's experience, right? And if she's experiencing it, like how many millions of women are experiencing that? Okay. So yoga therapy across kosha layers. Um, Again, it's so much easier to start with the physical body because it's tangible. So In a physical body, we can mobilize it. We can mobilize the body to ease stiffness, like move through the joints, right? In our breath body, pranamaya, we can reduce inflammation through accessing the parasympathetic activation in the nervous system. So we know that there's so many studies to show that specific breath work reduces cortisol, reduces inflammation. All right. In the mental, emotional, and wisdom bodies, right? If we do the first two koshas well, we start to cultivate an emotional balance and promote clarity. So that dissipation of that fog and that nervous system, right? That happens when there's those big hormonal fluctuations. It's always harder with the Anandamaya, with that bliss body, because it's so subtle, all right? But we could talk about it, building resilience through acknowledgement. So acceptance, right? Acknowledgement of transition and also acceptance of outcomes. So, but the outcome is that you're not going to be 25. So we have to accept that, right? And if we can't, we're going to continue to experience this lack of coherence. All right, so I just put it in there because I was thinking about it. What is my job as a yoga therapist really? Besides like providing an intervention or a protocol, but um, I should recognize as a yoga therapist that pain and emotion are integral to healing. We can't turn away from those things, right? We can't shelve them or like walk on eggshells around those things because they're integral to healing. And another thing I can do is to articulate that this inner coherence we've been talking about is not wellness. Okay, wellness is a made-up term that is really great for marketing, but that's not inner coherence. It's like being present across the full spectrum of being present with yourself through the whole thing, right? How the koshas fluctuate and how you fluctuate and you have the awareness of that fluctuation. Okay. It's a lot of stuff. I know. I think about this stuff all the time. Okay, and so we get to pain because pain is such a great example of like what we want to turn away from because who likes that, right? So I just wrote that in there. Okay, complex conditions such as perimenopause, menopause transition will require multi-layered healing. And I hope you've seen that, right, so far in the presentation. Pain specifically carries a physical, emotional, mental, and energetic, my God, dimensions tied to identity and change. So there's a lot. Pain is not just like my arm hurts. In this context, there's so many different implications, right? And for actually, like myself, I lived with chronic pain for about 2 years, at times very severe. And I honestly was not great, but I learned a lot. I learned a lot. And there was definitely an emotional, mental, and energetic dimensions tied, like 100%. And I had to navigate that, right? All right, so pain management. Okay, Western medicine, not to knock it at all. And I love Western medicine, we need it. But it, for the most part, suppresses pain through medication, which again, like I'm grateful for these medications, but if we're just like always suppressing pain, then we don't have a way to know what it's communicating to us. Okay. Like if somebody is calling you and you keep turning the phone off, like let's say it's your mom. I'm not talking about a telemarketer, but you keep, turning the phone off, you don't know what the message is. And it might be important, right? Yoga therapy uses koshas, we just saw them, to invite awareness of pain as a sensation to be understood, not avoided. So it's really radically different approaches, really radically different approaches. And it's kind of cool because both are valid, right? Okay, so when we take a look at pain and coach, just kind of run through that lens. Again, physical body, pretty simple. Pain you experience in your physical, it's an experience in a physical body. Okay, we all know that. It can get interesting when the pranayama in the pranic body. Um, it's a sensation that can be anchored to breath. So you could breathe through the pain, as you probably have heard, so that you're working with pranamaya kosha. Or pain will affect your breath such that you can't take a full breath. So it can go both ways, right? In the manamaya, the mental emotional, pain can be a really good narrative creator. Well, I'm in pain, so I can't do this. Well, it hurts, so that's what it is. And then it just starts to layer and layer and layer, right? Unless you are aware, unless you're actively working to not create a narrative around your pain. In the wisdom body, this is what I'm saying. Pain can be a messenger. It can actually be an effective communicator to tell you there's something going on and you need to address it. And then if you continue to mute it, it will continue to try and communicate, right? Like your mom. Mhm. Okay, Anandamaya in the bliss body. This one's hard, right? But I put it in there, and it's not even from a pain perspective, because what we're really seeking as yogis, and maybe as yoga therapists delivering these interventions to our students, clients, patients, is we're seeking steadiness amid change. Steadiness amid pain, very difficult, but can be achieved. Okay, so now neuroscience comes into the equation. I thought this was so fascinating, and yoga and pain, right? Like how are they connected? So we're back to the Huberman lab, and I'm not going to play it this time, but a few episodes ago, Andrew Huberman discussed this study. It was done in 2014. And so these are just some of the excerpts from this study. They looked at long-term yoga practitioners. These people started yoga yesterday or like last month. They have been practicing for a long time, established. These people had twice the tolerance to pain associated with either hot or cold stimulus. So they had to test, right? They weren't going to like stab these people or break their bones. They had to test somehow, like to initiate pain. So they used heat and cold and found that the yoga practitioners tolerated it twice as much as non-yoga practitioners or like general population. These same people showed an increased gray matter in their insular cortex. So the insular cortex is a part of the brain that is responsible for interoception, like internal awareness, emotion, and regulation. They had bigger brain. They had a bigger brain, which is crazy, right? They weren't building that brain through handstands, I can tell you that right now, right? It was probably a very integrated practice. The same people were found to cope through breath, pranayama, acceptance, and mindful observation, not resistance or distraction. So I hope that like when you look at this, you're really impressed because this is just telling you that these practices are really effective, but we just have to stick to them. All right, long-term yoga practitioners present with structural neurological changes. They have rewired their brains. Crazy, but also so cool, right? So cool. So this can be done. This isn't just talking. This isn't just a presentation. Okay. So going back to our menopausal menopause syndrome of musculoskeletal syndrome of menopause, sorry. And what kind of interventions we can do, right? Because how would we then serve the population that's experiencing these rough symptoms? And since we've been talking about the Panchamaya, it's nice to run through the Panchamaya once more. So in the physical body, right, we could create some exercises around joint mobilization that will reduce joint pain. Anytime you mobilize your joint, it reduces joint pain. It's very simple. We can also take a look at functional strength building. So if you remember that functional movement, right, building muscle, that could be with weights, but basically it'll create musculoskeletal support, right? So it'll support your spine, it'll support your hips, your knees. In the breath body, so many things that we could do, breath work, um, can start to optimize respiratory efficiency. So, meaning, are we like shallow breathing and just over breathing and just tiring out our auxiliary muscle of the respiration? Are we able to take a good, robust, full breath? All right, that's respiratory efficiency. If we're able to take a good, solid breath, that means that we're taking optimal oxygen, enhancing cellular health. Okay, because cells depend on oxygen. And from a pranic standpoint, we're regulating energy flow. If you remember Ida and Pingala, those left-right channels, intake, outtake, prana, apana. And of course, there's a tremendous impact on the nervous system in terms of different types of breath works and how it impacts the parasympathetic response. That's the nervous system. In the mental emotional body, the Manomaya Kosha, they found that Yoga Nidra is really helpful for interoception. So, like internal awareness, being in your body, being attuned with your body, listening to the body, right? Just colloquially taking you through that, all that stuff you might hear out there. And then in the wisdom body, meditation. All right, meditation reduces inflammation. So many studies show that. So again, really helpful tools to work with. In the bliss body, like I said before, this isn't something we work directly on, but it's a manifestation if the other koshas are addressed, right? We can start to cultivate access to that inner coherence, just like who am I being with myself, and what I mentioned before, steadiness amid change. So, kind of drilling down a little bit, right? Because again, these are really tangible things. Um, Working with a physical body, we can always start, like if we were developing a session or a protocol, we would want to start closer to the floor, floor-based foundations, closer to the floor. So it could be supine things, it could be hands and knees positions, right? And what they do is they really enhance grounding or a sense of being grounded. Because remember, like a lot of the people are experiencing anxiety about the condition. So they're ungrounded, they're unmoored. So we want to ground them. All right. It'll give them proprioception and create a sense of safety. So really simple, really effective. Joint mobilization is the next one. So if you remember, we talked about like, okay, moving through the joints just gets rid of a lot of pain, and it does. And it can be gentle movements. It doesn't have to be anything fancy. And it'll increase circulation. It'll produce more synovial fluid in the joints and increase range of motion. So, right? So if you like raise your arm and then you raise your arm better, that's range of motion. Strength building, we did talk about that. The loss of lean muscle mass is a huge issue. If you start to lose your muscle, you're also much more prone to falls because you just don't have enough muscle to support you. And so strength building becomes really key here. So just one of the way to get to it is isometric holds, which is when the muscle is contracted but not moving. So like think warrior two, you're holding warrior two for like 8 cycles of breath. That's a lot. And you're going to start sweating. And so you know you're working, right? Um, Isometric holds also really effective to teach the body how to redistribute load away from the joints and into the muscle. So if you're somebody who's hypermobile or have a lot of like joint range stuff, then doing isometrics is really helpful to you because it'll start to basically teach the body, hey, don't sit in your joints, engage the muscles around. Okay, yes. So strength building enhances spinal mobility, prevents injury, kind of talked about that already. And then resistance-based work. I did mention weights, but we can use a wall. Wall is wonderful. We can use a strap, right? We can use any props available to us. Functional loading means just to increase load into your body more than gravity, right? And all of those things will also help with bone mass. Okay. How are you guys doing? Give me a little wave. It's 4:30. All right. How about you guys just like take 1 minute? Let's do it together. We're in a pranamaya kosha. What a great time to take a moment. It's just like a lot. This is so dense. All right. So if you want, you don't need to participate if you don't want, because I can't really see you. But if you want to participate, just shift to the edge of your chair. You're still sitting on it, but just the sitting bones are on the edge of the chair. So your knees are roughly 90 and your feet are planted. And then just go ahead and bring your hands down to rest on your thighs. And just feel your pelvis neutral and heavy and grounded on your chair. And then think about extending up through the crown of your head. So you're lengthening through the spine, but not so much that your ribs start to flare. So just a gentle awareness of a lift without strain, and then allow the shoulders to drop away from the ears so the neck is long. And you can close your eyes if that's okay for you, or keep a soft gaze. Bring the awareness to the breath, breathing through the nose. Soft, uninterrupted, natural. And we'll take 3 cyclic sighs. Start to inhale. Pause when you're 3/4 of the way in. Hold. Then inhale all the way in and really expand. Purse your lips and exhale. And then again, inhale 3/4 of the way in, pause. Inhale all the way in, expand the ribs. Purse your lips, exhale. And then do one more on your own. Bottom of your exhale. Go ahead, open your eyes if they were closed. And just notice your state. We only took 3 cycles of cyclic sighing. This is a Western breath work, and it's meant to be a very quick hack for your nervous system to put your nervous system into calm and alert. Okay? All right, so we'll continue on with the presentation. So how would we apply? What would we do, right? We looked at the anamaya, the physical body. What would we do in a breath body? in a pranamaya. So many things, so many things. So MSM, musculoskeletal syndrome menopause, right, creates, we talked about it, postural changes, stress and anxiety, as well as pain. All of those things can negatively affect the breath mechanics, right? So that could be a number of things. Think of it as inability to take a full breath or just you're overbreathing, right? Um, well, we can use asana. Asana is important because if the spine is in the wrong position, it's going to be very difficult to work in the pranamaya kosha. So we do want to use some asana posture, but we can also use a lot of pranayama techniques, breath work, to optimize respiratory mechanics and pranic alignment. All right, pranic alignment, really good stuff because if you see that little man, I just like copied it from Hatha Yoga Pradipika in the diaper. You see the man in the diaper? Uh-huh, good. Okay. So you see the orange, that's prana. That's the first one. So there's 5 vayus. They are pranic currents, directionalities. Okay. We're in a pranamaya body. I know there's a lot of detail. Um, the prana intake happens where that orange is in the chest area. So if our chest area is collapsed, there's not going to be a lot of prana intake. So we have to open the chest, right? Then we can talk about intake of prana. And once we have the intake of prana, we can then talk about apana, which is the elimination. So intake prana, eliminate apana. Those two are important to balance. All right. Once those two are balanced, we're talking about pranic currents. We activate what's called a samana vayu, pranic current that's responsible for assimilation. So it takes prana, breaks it down, okay? And then once it breaks it down, there's another current called Vijnana that picks up and starts to circulate the components of broken prana through the body. Okay. The last one is Udana, that's in pink. And that one, and again, similar to how Anandamaya Kosha is kind of difficult to access directly, Udana is a little bit difficult to access directly. But maybe once the other pranic currents have been optimized, we can start to experience this Udana Vayu, which is really happening in the chest and up, and it adds refined awareness. So now we're working with clarity. All right. So there is different breath work practices to get it to these pranic currents to optimize them. All right, so that's how we would approach the pranamaya kosha. Okay. Um, as far as the other two koshas, the manamaya, the mental emotional, the wisdom, we can use yoga nidra. All right, yoga nidra is really effective to improve sleep quality, to reduce pain, to reduce anxiety and depression. Okay. Also increase awareness of the body itself. Okay. You guys know what yoga nidra is? Like body mapping, right? Feel your finger, feel your nose, that kind of stuff. If you've ever done it, you know how effective it is. Like you feel better right away. A lot of different meditation techniques. Meditation as a in a general way, reduces inflammation. Also by reducing these pro-inflammatory cytokines. All right. So things that circulate through the body and create inflammation, pro-inflammatory cytokines, so they will be reduced when we meditate. And that reduces general and systemic inflammation. There's another technique that we learned in yoga therapy, which was interesting, called EFT, emotional freedom technique. And that one is tapping. It uses fingers to tap on different parts of the body. It's really simple. And that's also been shown in research to reduce pain and intensity of pain, regulate neural circuits. So perception of pain. So physical pain and perception of pain, right? and then to lower inflammation. So again, cortisol, we're always looking to reduce the cortisol. Okay. Anandamaya. So Anandamaya is it's a cultivated layer. It takes years of practice attuning to this inner coherence states via practical yogic tools. So the kosher itself might be difficult to access, but the tools are out there and they're easy to do as long as you stick with the practice. Okay. Another way to get into the Anandamaya kosher is to work with what we call kleshas in yogic philosophy, and they're mental afflictions. And so once we kind of really look at what those afflictions are and start to work through them, we can then have this pathway to Anandamaya kosha, right? So there's five kleshas in a context of perimenopause and menopause. It could be attachment to youth and vitality. Alternatively, it could be an aversion to getting older, loss of physical ability. Um, a good one, my favorite one, ignorance, right? It could just be you just don't know what's going on. You're just ignorant. So just get educated, right? Um, Egoism, belief of limitation by physical body and thought. So you let this life stage define who you are rather than the other way around. And then fear of death, of dying, right? Of not being. So those are all kleshas. Again, we're not going to get into them because then we'll be here till tomorrow. Practical advice though, work on the four less subtle koshas, and then you'll get to this one. All right. Oh my God. Yay. We're in TTT group. Hooray. Okay. So musculoskeletal syndrome of menopause, right? We saw it. It significantly impacts quality of life, mobility, long-term health. And while there's really great conventional treatments such as MHT, they don't get into this biopsychosocial issues. And that's where the yoga therapy comes in, right? And so we know that there's need for integrative care that's evidence-backed and that's holistic. And it can also empower women to restore confidence, right? Not just in movement, but movement is important, but also to embrace change that's happening to them. Yoga therapy as an intervention can be really impactful because it can address pain, right? Through all these different aspects we talked about. It works really well with this Panchamaya framework, targeting, different layers of being, right? But also simply working on joint stability, right? So it's great. It's very practical, and it's very accessible. Okay, closing reflection. Let's see what it says. I just wrote it this morning. Oh yeah. Um, I thought about this. How does yoga and yoga therapy intersect? And this is just my reflection. This isn't like backed by research. But yoga therapy, we talked a lot about pathway toward inner coherence or Anandamaya kosha, right? Because that's healing. And when we are experiencing that state of inner coherence, we're in a state of healing. Um, and we're able to perceive our entire selves, right? Because we're in the most subtle layer, so we can see outward. Yoga, the second sutra, so yoga is grounded in the Yoga Sutras, and the very second sutra states Yoga Chitta Vritti Nirodha. And so yoga is a restraint of the modifications of the mind stuff. It's a direct translation. So very similar, very similar. We're going for inner coherence, and then we're going for a cessation, a stabilization of consciousness. Okay. As teachers and therapists, we serve best by embodying these practices as we guide the students, right, and on these continuums. So it's really important for us to remember if we're teaching, if we're delivering, that we embody what we're doing. All right. I'm going to skip this because it's just something. And then thank you so much. I know it's a lot. You guys did great. Okay, I'm going to stop sharing my screen.